going to go as far as his lawyer did, which is we won. I think he's going to go the more patient way and the more wait until every balance counted.
Hi, my name is Mallory and I'm a nursing student. Today I'm going to be doing a full head to toe assessment. Can you please state your name and birthday for me?
Natalie Walters, 8401.
Okay. We're just going to verify with the doctor's orders. Okay. Do you have any allergies at all?
Just the amoxicillin.
Okay, I'm going to check the wristband. Great. Alright, so I did close the door for patient privacy. I'm going to wash my hands for infection control. And I have gathered all of my supplies. So first I'm going to put some gloves on. Actually, I'm not going to put gloves on yet. I'm going to take the gloves with me because I'm going to do the apical pulse and blood pressure first. So I have all my supplies, already verified my doctor's orders. Let's actually move these over a little bit more so I can put stuff over here. Okay. So like I said, I already verified the patient's wristband, and they already told me they don't have allergies, or that she does have allergies, and her name and birthday. Okay. So first, I'm going to have you put this arm up here to obtain your blood pressure. And I'm actually, sorry, I'm going to have you take your arm out just to get an accurate reading. Thank you. A little too much skin in here. Why don't I see it? It doesn't show. That'll break you. So I'm going to do the two-step first and just listen. Or two-step, listen next. I'm going to feel first where to go up to. Whoa, you're pumping today. Okay, I stopped feeling it at 140. No, I don't like that. Alright, so next I'm going to give her just a minute, and then I'm going to go ahead and start with the actual blood pressure.
Ooh, just totally.
So I said earlier. Clarify her brachial.
Well, I just think we want to be fully.
Should be really close.
There's a lot of pushback.
Okay, I'm going to feel a tight squeeze.
From the Trump campaign saying they still have a path.
That's what McCain McCarthy said just a few minutes ago here.
Yes, and we are very transparent about this. I grilled the decision desk guys about it numerous times last night. They are still confident in their call on that.
118 over 62.
But there may be,
Which is good.
and we're going to see tonight.
20 over 80 is normal range, so I'd say you were normal. Okay, so next, that's fine, you can leave that. Next, I'm going to take your apical pulse for 1 minute. So I'm going to do this, I'm going to locate the angle. I'm going to locate the angle of Louis on your chest here and go down to the second intercostal space. And then from there, I will go over to the fifth intercostal space. And that's where I will find your apical pulse. I'm going to count that for a minute then. So the normal range is 16 to 20. Okay. So your angle of Louis, on the second, and over to the fifth. Put that. Okay.
If that happens, if that comes to pass, he will have to work with Mitch McConnell and try and come to compromise and come to centrist. The whole point of the filibuster is to keep the country centrist and stable. The Senate is supposed to be the cooling mechanism over the House, and it was going to go away.
Yeah.
And now, if this happens, it's not, and that's good for our democracy.
The House runs hot, that's for sure. Cool it down. And Juan Williams, do you think that the Democrats are
You had 87 beats per minute, and like I said, 60 to 100 is a normal. Okay, so next we're gonna begin the rest of the assessment. So I'm gonna put some gloves on. Infection control. Of course, my hands are sticky now. Oh, gosh. I'm actually going to have you take your ponytail out and your hat off, please. Okay. I'm going to start by just running my fingers through your hair and assessing your scalp. Okay. Her hair has a nice moisture texture. It is not thin and brittle. It's very thick with a dark brown or rich brown color. I don't see any manifestations such as lice or anything like that on her scalp, or any red spots, no irritation, itchiness. Is this itchy at all? Okay. I don't feel any nodules as I feel her head. Okay, that feels good. And it's evenly distributed throughout her whole head. There's not patches that have more hair than the other. Okay, so next I'm going to go to your face. And I'm just going to look at you, and I've kind of been assessing you since I walked in and started the assessment. Your face seems to be symmetrical on the left and right side, all the way down. And I don't see any abnormalities on either side at all, which is good. Can you smile, please? Frown. Okay, everything seems to be very good bilaterally there. Everything's symmetrical. So next, I'm going to grab my pen light and just start by looking at your nose. The left and right side are both very symmetrical. They both seem to be in good shape, no abnormalities. You do have a piercing on that side, which is still good. I don't see any discharge or infection there. So I don't, like I said, there's no discharge. It's a nice pink color. So next I'm going to just shine this up there and make sure, yep, no discharge, like I said. Okay, so next I'm going to just have you do it for the patency. Hold one side of your nostril and in, and then the other side. Okay, good. And I didn't see any obstruction when I was using the pen light. So next I'm going to palpate your sinuses. I'm going to start with your maxillary. Let me know if this is tender at all. Your frontal. Nothing seems swollen, so there are no issues with your sinuses. Next I'm going to start by going to your mouth. So I'm going to inspect your outer lip, and then I'll move to inner and then go inside your mouth. So your outer lip seems to be good. Okay, inner, everything is nice and pink. Great. So then I'm going to look at your teeth. She's got her normal teeth. They're white. No chips or major issues that I see. Her gums are light pink, not red. Red could indicate inflammation or an infection or conjunctivitis. Conjunctivitis. That is, you could have different issues in your mouth, and I don't see any redness, so that is good. Next, I'm going to just have you stick your tongue out, please, and go side to side. Use my light and go one way. Okay, up and down. Okay, great tongue movement. I'm going to look at your oropharynx and your tonsils next. So if you can just open up wide, please. Great. Awesome. You don't have any redness or inflammation, swelling in the back, so I think you're good there. So next I'm going to remove my gloves and put a new pair of gloves on and start palpating your lymph nodes. Great, my hands are all sweaty now. It's probably not going to work. I'm going to pretend I have my gloves on because my hands are warm now and I can't get them on. Make this easier. Okay, so next I'm going to start by palpating your lymph nodes, your occipital, your postauricular, your preauricular, submandibular, superficial anterior cervical, your posterior cervical, and your supraclavicular. Good. There's nothing tender as I was feeling there. Okay, those aren't swollen at all, so that's good. We're going to continue on with the assessment. You kind of already assessed you a little bit when you had your arm out, but what skin I can see, your arms, your hands, your neck. Your skin is a nice pink, tan pinkish color. It's not red, which is good, and it doesn't look dry. It looks pretty moist. Good. And it could be a little dry this time of year because it is winter. So next I'm going to actually just touch do some little tests to see how fast your skin turgor appears, and we'll do it on your neck. Good, it goes back right away. So next I'm going to look at your nails and start assessing for capillary refill. So she doesn't have polish on, so it's easy to see. They're light pink color, and I don't see any issues like redness. Capillary refill returns right away, which is good. So she does not have any edema. I can already tell in her legs, which would be main sign would be swelling, and like her calf could be the main spot. You could see it. So the edema scale, if there was one, when I depressed on it, a 1 would be if it depressed had a 4 millimeter depression. A 2 would be a 6 millimeter depression. A 4 would be 8 millimeter depression when you push, and that's good because, like I said, she does not have any edema. So next, I'm gonna look at your. Let me just put this up a little bit. Thank you. So next, I'm looking at your peripheral veins in your arms and legs, and I don't see any issues. You could notice phlebitis. Good, those look good too. I don't see any issues. All right, so next I'm going to start by looking for some lesions on you. And I have noticed a few on your face. I believe that's something. Yep. So you have a mole on your chin, and it's like right around the center underneath your lips. And that is also called a nevi, which is another word for a mole. So next I'm going to move on and look for muscle tremors, and I have noticed you haven't been shaking or anything, so I think we're good to move on with that. I would notice that assessment from the very beginning. When I first walked in, so I also, when I was assessing your skin, I could kind of feel you're a little warm, but could probably open the windows in here and take off a few layers of clothes because it's a beautiful day out. So we're good there. And then you don't have any shaking when I push down here. That's good. And I haven't noticed any swelling on you as well. And you don't have any pain at all, correct? Okay. All right, good. So next we're gonna move on, and we kind of looked at some things on you now, so we're gonna be moving on to range of motion, and I'm gonna do some tests on you to see how strong you are. So we're gonna start with your trapezius muscles. I'm gonna push down, have you push up, your sternocleidomastoids. All right. And then we'll go to your deltoid and your biceps, and you put your arms out. Down. All right, and you go like this. Straight out. No, one off. Right there. Push again. All right, good. Now, how about, can you try to pull my fingers apart? That was easy. Can you do range of motion with your fingers? Lay back down, good. How about stand up and do hip abduction and adduction? Good. All right, let me sit down. All right, your quadriceps resist. Yep, push out. Whoa. Great. All right, now your feet. You lift your foot up, push down, other way. This foot. Good. All right. So next we're going to move back to your vision, because we did not do that, and then I have your ears to do also after I just did your muscles. And also I should notice that, which I can go back to, you don't have kyphosis or lordosis. You have a normal curve in your spine, which is good. There is no abnormal S inward or outward, so that is good. Scoliosis would have been another one, which is like a major S curve. Okay, so like I said, we're gonna go back up to your ear. Actually, we'll do your eyes. So I'm gonna ask you some questions first off about your vision. Do you wear contacts or have any glasses at all?
I have contacts.
Okay. Do you stay up on them? You keep.
Yep, and
Okay.
take them out
Take
at
them
night.
out at night?
Yeah.
Okay, have you ever had any eye surgeries?
Nope.
Do you have any eye pain at all currently? Okay, your eyes don't feel like they're straining at all? Okay, good. So first I'm going to start with looking at your eyebrows, your eyelashes, your exterior eye, and go from there. So looking at it, your eyebrows are evenly distributed, and like I said, I would have more gloves on. Your eyelashes are evenly distributed, dark. I don't see any issues there. And like when I kind of examined all the way around your face, I noticed your sclera and conjunctiva look good, which is what I'm looking at now. Your sclera is very white, your pupils are evenly dilated right now, and your conjunctiva is light pink. So I'm going to start by just doing some bilateral responses, and they should be bilateral when I shine the light. If you can look straight ahead. this side. All right. They're constricting bilaterally, so that is good. Next, I'm going to assess for some visual accommodation, which I kind of just, I need this paper. I'm going to also do some side movements, like this 6 cardinal gazes, and I also want you to tell me when you can see my fingers.
No. 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 No.
Okay, and then I just want you to follow my finger. Good, they seem to be moving. Great. I don't see any stickiness at all. Good job. Okay, so next I'm just going to have you read this. I just want to see if your near vision is working. So,
Southwest Tech Hospital physician's orders.
yep, and then I want to just make sure your eyes constrict. Can you follow the pen, please? Great. They moved in equally, so that's good. We want everything to be bilateral. So next we're going to move on, like I kind of had mentioned, to your ears and your hearing. So I'm going to ask some questions like I did with the eyes first. The first one is going to be, do you have any hearing aids? Okay. Have you ever had trouble hearing, or do you have a hard time hearing that you know of? How about any ear surgery? No? Okay. So I'm going to start inspecting your ears. I do not have an otoscope, so I'm just going to use my pen light and work as best as I can today. So I'm going to pull your ear up and forward, and then I'll pull it back.
Whether or not that dynamic changes,
Oh, getting your earrings.
we will see. But there's no
Alright.
way that they are ready.
That looks good. I don't see any wax buildup.
We've just been talking about them watching numerous legal battles. They want full transparency on the county of Michigan, which both sides.
All right. So I'm gonna do a few things where I want you to hear or say what, or like listen and say what I'm or what I'm saying. Hear what I'm saying and tell me what it is, just to test your hearing a little bit. So, like I said, I didn't have the otoscope, so that I will just move on to that. And when I do like feel around your ears, palpate a little bit. Is it tender at all? Okay, nothing feels red and swollen, so that's good. Can you tell me which ear I'm clapping outside?
Right.
I'm doing now.
Left.
Okay.
Cat. Dog.
Okay. Seem to have great. Speaking of dogs, she's passed out. You seem to have good hearing, so that's good. We will continue on with assessment. Next, I'm going to go and have you take your fingers and take them straight up to your nose. Great. So that is just, I'm assessing your fine motors. You can take those down, please. I'm going to also look for the Babinski reflex now that we're on going towards the lower portion of your body for this exam. All right, good. Didn't have the right tool, but that works. I'm also going to have you get up and walk here in a second, and I'm just going to watch and see how your gait and stride are. And if they're even, when you walk, you should have an even stride. And then your gait is if you're kind of wobbling, if you're straight, how comfortable you are walking, just making sure. So if you could just get up and walk from here to the couch, please, or even or to the wall, whatever. Okay, great. Great. Her stride and gait are normal and even within each walk, or each little step. So that is good. Next, I'm going to just kind of look at your memory with your neurological assessment. And I just want you to remember these 3 words, and hopefully I remember at the very end to have you restate them. Door, window, and light. Or lamp. Either one works. So I'll have you restate those at the very end. So next we're going to move on to your respiratory, which will be like your chest area. I'm going to ask you a few questions like I've done for the rest of the assessment. Do you smoke at all, or do you have trouble smoking? How about trouble breathing? Do you ever feel out of breath easily if you're walking upstairs or to the kitchen? Okay, that's good. So I'm going to just have you take some big, deep breaths, and I want to, your anterior and posterior thorax, make sure they're rising symmetrical upon both sides. Great. Yep, and it should be about 3 to 5 centimeters up and down, or in and out. Good. So your chest is rising great. Your thorax, posterior, and anterior are rising 3 to 5 centimeters each, so that is very good. Next, I just want to make sure can you do it again? Without making you take your shirt all the way up. Okay, left and right side. Yep, exactly the same. Okay, good. So next I'm going to start palpating your thorax a little bit and listening for some lung sounds. palpate actually before? Is there any tender at all? Okay. And do your posterior.
Turmeric helps with healthy joints and inflammation support.
Okay.
Unlike regular turmeric supplements, she knows superior absorption.
All right, good. And I'll actually just do some more questions before I start listening, because I will just do your abdomen and everything at the same time then. So a few more questions. Have you ever had chest surgery? How about, do you have a pacemaker? Okay. How about family history of heart attacks or strokes? Pretty easy. Okay, so I'm going to just have you take some deep breaths again. Good. Just feeling your pulsations. And I already palpated. Big breath. Okay, and before I listen, I'm just going to feel your carotids. One at a time. These ones are not bilateral. Okay. Alright, I'm going to start by listening.
You prayed that prayer. I want you to call the number right now that's on the screen. We got someone about to pray.
I'm going to listen to your aortic, pulmonic, and Erb's point. So your aortic is over here, your pulmonic, your Erb's point, and then I'll go down to your tricuspid and mitral, and I'll just do it under your sweatshirt so I'm not exposing you too much. Your aortic is up here, your pulmonic, your Erb's point is in the middle. Okay, your tricuspid and your mitral. Good. That sounded good. So I'm also going to just listen to a few spots on your back. It's kind of like an S, just to make sure everything sounds great back there. Put my hand on the sweatshirt. You're warm.
Good afternoon to you, and thank you for your time here today. 21,000, I think, is the last mark. How does the recount work in your state? Yeah, well, thank you for asking.
Good. So your S2 sounds are heard best at the end of your systole, so when you're taking deep breaths. And your S1 is loudest at your apex of the heart, which I heard in the beginning, which is your anterior chest, and then I did your posterior. So next we're going to go on with the assessment, and I did your carotids. Next will be your abdominal, and I'm also going to assess for your peripheral pulses. So I did your carotids, but I'm going to start back at the top again and do your temporal. You have such good pulses today. Carotid is not bilateral, like I said, so one at a time. Your brachial. Your radial. Femoral would be right there. We are not going to do that. And then your popliteal. Posterior tibial. And your dorsalis pedis, which is the top of your feet. How was it? There.
There you go.
Thanks, patient. Okay, so the very last part of this assessment is going to be your abdominal assessment, where I'm going to be listening to some arteries and your quadrants and bowel sounds in your stomach. So I'm going to have you void. We're going to say you voided before this exam. I'm going to have you lay down with your legs positioned lightly flexed, so kind of up. Too far. I feel like that's too far. No? Are you sure? Okay. All right. So size, symmetry, and contour I'm going to look at. Tiny, very tiny. Okay. Right and left seem to be symmetrical. That's good. Okay. So I'm going to start by using the diaphragm and start in the right upper quadrant, listening for vowel sounds.
Yes, the results from Milwaukee County are in Milwaukee County's.
Can you raise your head a little bit, please? Thank you. Okay, right lower quadrant.
Okay, so we got the machine working here, okay? I don't know if you can see this, I don't believe you can.
And your left upper quadrant.
Milwaukee that we were tapping on so often last night. Joe Biden.
Left lower quadrant. Are you following?
Compared to Hillary Clinton. Look at that.
Okay.
Look at that.
Okay, I'm gonna listen for vascular sounds next using the bell, so I need to flip it around to my bell sign sound, or side. Okay, so I'm going to start with the right renal artery,
Wisconsin was very
the left renal artery,
with what we saw in 2016. Joe Biden did just a little bit better, and so in 2016,
the right iliac artery,
percentage point.
the left iliac artery, and femoral's a little lower, right around a little lower than this. Okay. Next, I'm gonna palpate the abdomen,
Thank you, sir. Here's the one.
just making sure to go just 2 inches.
Joe Biden just in the last hour, as Chris Wallace was pointing out here, for Biden at 248, if you were to take Nevada, it's super close there, by the way.
Any abnormal noises at all?
And then if Michigan is,
Anything tender at all?
Michigan is barrel.
I don't feel any budget or any
You're at 270.
masses at all or any bumps, nodules.
They feel real good.
Okay, I'll help you sit up.
Here we go. They feel
Alright. Is there anything else I can do for you today?
I don't think so.
I have time. Okay. Alright, so I would remove the gloves that I had, the other gloves that I said I had on, and wash my hands for patient or infection control, and then I would walk the patient out, clean up and everything, and shut the door for patient privacy. And then I would document everything I found, from the bowel sounds to anything abnormal, and just that I did the full head to toe assessment on my patient.